Well, good afternoon. It is great to see you. I would like everyone to meet Dr. Danielle Maack. And your name of your practice is Delta Autumn, correct?
Yep, Delta Autumn Consulting.
And that is in Oxford.
Mm-hmm.
Wonderful. So thank you for your time today. I certainly appreciate it. It's good to see you, even though we're not physically together.
Yes, yes. No, thank you for inviting me on. I'm happy to be here.
My pleasure. So, can you give me a little overview of what your consulting business does, what you do specifically?
Absolutely. So, overall, we're considered a psychological associates practice. So, we have three PhD level psychologists, we have two master's level clinicians, and we do a lot of assessments and therapies and groups. Specifically for me, I do a lot of the individual therapy with older adolescents and adults.
Okay, so that's really your focus is older adolescents and adults.
Mhm. It tends to be for me, well, a couple of things. We have a couple other providers who focus on more of childhood disorders and parenting. And a lot of my kind of specialty area is more in the more severe mental health concerns, whether it be bipolar disorder, severe post traumatic stress disorder, and emotion dysregulation. So things that we might see associated with cutting or borderline personality characteristics and
I
features.
gotcha. Okay. And so, how long have you been in private practice?
So we actually, in January 2021, will be 10 years in private practice.
Wow, that's
So yeah,
wonderful.
I was thinking about that the other day. At master's level, it's been since about 2003, I've been seeing people in clinics and other things, but private practice as a PhD, it's going to be 10 years. It's
Wow. Well,
surprising.
congratulations. That
Thank
is
you.
wonderful.
We're
Yeah,
really excited.
you should be. You perform a really great service, and I know you're very involved in the community as well, and focused on dispelling a lot of myths that come along with mental health.
Yeah,
So, trying to remove the stigma, and that's a huge job, and we all need to do
absolutely.
our part.
Absolutely. I think the more that we can encourage people to talk about mental health concerns and not see it as this scary thing that we need to avoid, or that it's, mental health means it's scary and it's dangerous and all of the negative connotations, the more we can see that mental health is health. It's a part of our overall well being, and that just like with physicians, where we're asked to do a wellness check, right? Wouldn't it be great if we could have mental health wellness checks just be a part of our yearly check in to demystify it? And if there is some sort of concern, why don't we get help before it gets more serious? And that's what I really hope a lot of the more community based information, if we can get that out there. There's providers like what you're doing, if you're trying to let people know who's out there, what specialties are, where they can be seen, that it doesn't have to be only if you're falling apart and having severe problems to go talk with someone, but for generalized anxiety, depressive symptoms, adjustment issues. I mean, who right now isn't having some sort of adjustment difficulties? And if it just crosses that line to needing more help, it's available. And to know that there are people there who are trained and happy to be of assistance.
That's wonderful. Very well said. Thank you. Yeah, that's exactly what I'm trying to do here. And so I
Mhm.
appreciate your help with that. Um, so, what would someone need to do in order to schedule an appointment with you? What's the best way to do that?
Yeah, so the best way is to call Miss Candace, 662-259-0868. And she does the scheduling. She's great with helping understand insurance, out of pocket, or if we can't help, or if we're not on the insurance panel for people, we try to help figure out who they could be seen by. And
Okay,
even some of the free resources in the Oxford, Lafayette University area where possible.
that's wonderful. So, which insurances do you take?
Mhm. So we are on panel with Blue Cross Blue Shield, the AHS or the state system here, as well as Blue Cross Blue Shield across most all states as well, and the Medicare panel.
Wonderful.
We do some contracts for workman's comp as well, but
Okay.
those are handled case by case with the workman comp company.
Of course. Well, that's very good to know. That's wonderful. So, what is there anything that you would like to say other than what you already said so eloquently that you would like to kind of leave us with before we wrap up?
Well, I think the emphasis is just mental health is health. Unfortunately, there's still a lot of stigma there. And the more we can break the silence that, hey, going to therapy is just like if you were to go and get your dental check. It's just like if your arm is broken. Are you going to try to take care of it by yourself when you're not a trained physician? No, that's unthinkable. Why not do the same with mental health too? And that even though you might not know about all the providers, there are people who are wanting to help you connect with others, and there are really well-trained professionals in the area. It's just figuring out how to connect. And you know, through what you're doing, Karen, I guess I should put a plug out there for the LOU Mental Health Alliance.
Yes.
We are going to start getting that up to get a resource list for telehealth options and other things in the community, to get resources out there for people who are wanting to be connected. So
Wonderful.
if you're not connected and want to be, lots of people are out there to try to help get you connected.
Excellent. Thank you so much, Dr. Mock. I really appreciate your time.
Thank you. I appreciate this.